Hey guys, welcome back to my channel. It's Jessica Ward King, the StigmaCrusher here. So you've decided to try therapy or counseling. Congratulations, it's a big step. And it's only a big step because of the stigma that's involved in mental health and mental illness. We feel like counseling or therapy is an admission of, guilt or of being broken somehow or of needing help that everybody else doesn't seem to need. There's going to be a whole nother video on do I need mental health therapy or counseling and how do I know? But today we're going to talk a little bit about what happens when you finally decide to get counseling or therapy and you start looking for a professional. It can be completely daunting. If you go to, Psychology Today or BetterHelp or any of the websites and type in, how do I find a therapist or find a therapist near me, you will get a list of people that have letters after their name like alphabet soup. You can have MSWs, you can have LSWs, you can have PhDs, PsyDs, MDs, you can have literally any number of combinations of letters after their names. So what does it all mean and who should you be looking for? You would think that there would be a really good answer to that question. And I guess it's not a great way to start a video by telling you there's not a good answer to this question. But I'm going to walk you through a little bit what it means to have the different designations and what kind of counselor you might want to be looking for when you start looking for counseling or therapy for a mental health problem. So first things first, counseling or therapy. You've heard me say these two terms sort of interchangeably, sort of at the same time throughout the introduction to this video. If you ask any professional, what's the difference between counseling or therapy? You might get a different answer depending on who you ask. Some will say there's really no difference between counseling and therapy. Some will say there's a slight difference, and some will say there's a huge difference. I'm here to kind of summarize what the differences might be. So counseling and therapy can be two slightly different things. We do use them interchangeably. It often depends on what a person prefers to say, and that's based on stigma a lot of the times. So sometimes people prefer to say, I'm seeking counseling because it sounds a little bit less daunting or less clinical than saying I'm seeking therapy. However, as the language of physiotherapy and occupational therapy starts to come more and more into our language, I find that distinction is starting to fall away a little bit, and I'm glad about that. The real difference that I find between counseling and therapy is really one of theoretical bent. So counseling tends to be more pragmatic. It tends to focus more on what are the problems that you're having and how can we solve them? So a counselor might say to you, okay, what are your problems in daily living? What problems are the depression that you're experiencing causing you? Are you able to work? Are you able to do your daily tasks? Are you able to participate in relationships with other people? And then based on whatever problems you're having, they might work with you on solutions. Therapy, on the other hand, tends to be a little bit more theoretical. So it tends to ask the questions, why are you experiencing this? What are the inner causes of these experiences? And therefore, how can you overcome them? Now, in a practical sense, you're going to counseling or therapy really to uncover both of those things. So why are you like this so that you don't continue to be like this? And what can you do to fix whatever problems you're having in daily living? And therapies like cognitive behavioral therapy, which, by the way, have therapy in the name and therefore you would think would just be the province of therapists, can really be done by both counselors and by therapists because it's cognitive, meaning it's talking about how you think and how you behave and how you feel. And it's behavioral, meaning talking about what you're doing and how you can change what you're doing. So both counselors and therapists can do cognitive behavioral therapy, same for dialectical behavioral therapy, and really a variety of the therapies. So really, what's the difference between counseling and therapy? That depends on who you ask. It really depends on how you prefer to frame it, how you prefer to talk about it. A lot of therapists don't mind if you say that they're doing counseling. A lot of counselors don't mind if you say that they're doing therapy. And really, it's a personal choice. Where I find that the differences come is really in what those letters after the names are. And even then, I'm here to tell you that the differences are not that stark. So I immediately hear social workers and psychologists saying, yes, they are, they're different. Yes, they are different. But what I'm meaning is in terms of who you're looking for when you're looking for a counselor or a therapist. Is there a huge difference? Are you specifically looking for a master's in social work, or specifically looking for a PsyD, or specifically looking for a PhD? Really isn't the issue. What it really comes down to when you're looking for a counselor or a therapist is personal fit. Do you like the way that they interact? Do you like the theoretical bent that they're taking? Do you like the way that they approach therapy, the way that they approach you, and do you really like the treatment plan? So you're wanting to talk with them in a first instance about, how do they intend to approach your problem? Is that a way that you also like to approach your problem? And really, what can they do for you? How much does it cost? Because these different options are going to cost different options. And how long do they intend to work with you on this problem? So therapy does tend to be a little bit longer lasting than counseling in terms of like number of sessions, number of weeks doing it, just because therapy is trying to uncover those deeper seated, motivations behind behavior, whereas counseling is trying to modify behavior, generally speaking. So you may find that there are differences in costs and differences in time there. But an MSW is a master's in social work. This generally takes 2 to 3 years of education to achieve. And social workers have a variety of arenas where they can work. They can work in care homes. They can work in children and family services. They can work in marriage counseling. They can work in individual counseling, in group counseling. Masters in social work really are jacks of all trades, but masters of many, not masters of none. And before the pandemic, I find that a lot of private insurance companies wouldn't cover MSWs as counselors for individual counseling, and now a lot of them do, because during the pandemic, the desire and the need for counseling, individual counseling, went way up. Online counseling providers popped out of the woodwork. A lot of those online counseling providers were struggling to find counselors and therapists, and MSWs really answered the call. And so there were a lot of individual therapists that cropped up that were masters in social work. You're going to find that I'm talking about a lot of different designations. Masters of social work, it just means that the master's is a postgraduate course right after a bachelor's degree that is a shorter duration than a doctorate. But that doesn't mean that it's worse. That doesn't mean that it's lesser quality. It simply means that they've focused on different things in their education, and they're really focusing on those practical aspects. So that's a master's in social work. The next one we'll talk about is a PsyD. So that's a doctorate of psychology, and that one takes about 3 to 5 years to complete and is focused really on the clinical aspect of psychology. I will say that only those with a doctorate, so a PsyD or a PhD, can be called psychologists. So those with a master's cannot be actually called a psychologist, which is why originally insurance companies had trouble wanting to cover them. And so you'll see a PsyD and a PhD can be actually called psychologists. PsyDs did not spend a great deal of their time in their degree doing research into the clinical aspects of psychology. They spent their times shadowing other psychologists, doing their own therapy under the supervision of a psychologist, and really getting prepared for the workplace in terms of getting prepared for counseling and therapy with clients. So they have a doctorate, and they didn't do a whole lot of research into psychology. A PhD, it takes about 5 to 7 years. They also have a doctorate. They are also a full psychologist. And the reason that their degree took longer is because they had to do a research-based thesis, and they spent a lot of time doing that research-based thesis. So in addition to their clinical work, which the PsyD would have done, the PhD would have done that clinical work as well as done a research-based thesis. And you may be saying, why do I need someone that's done a research-based thesis to treat me as a patient? You don't necessarily. As I say, a PsyD and a PhD, there's not, one is not better than the other. And just because a PhD has taken longer at their education doesn't mean they're better than a PsyD who's taken a little bit less time. Where you might find that it's useful is if they have a particular concentration in something that you're specifically struggling with. So for example, if they did research on, for me, bipolar disorder, going and speaking with someone who has research and theoretical basis in bipolar disorder, as well as that clinical training in particularly bipolar disorder or in other clinical settings, might be more useful to me than for somebody that is struggling with a marital problem, family dynamic issues, or depression or anxiety that doesn't have a particular need for someone that's been specifically trained in that area. So in some cases, the more specialized the issue, the more you might be looking for someone who's done some research in that area. But again, doing your clinical residency and shadowing experts that are already experts in that area can be just as good. Again, it comes down to good fit, cost, timeline, all those things I've discussed earlier in the video. The last kind of professional that I want to discuss is the MD, so the medical doctor. And in psychology and psychiatry, we're really looking at psychiatrists here. It used to be the case that psychiatrists would do a lot of therapy. Sometimes they do now because of the way, and I'm living in Ontario in Canada, so our healthcare goes based on our province, or for those of you down in the States, it's like our state. And so here the way that psychiatrists are encouraged to bill for their services, they bill the province, and it's based on a number of minutes with a patient, and so it's not really to their benefit specifically to be doing long-term therapy with their patients. And so quite often psychiatrists don't do a lot of talk therapy anymore. It still happens. I've heard of it. I've seen it. For example, interpersonal therapy, or IPT, which is a very short course, like 12 appointments sessions, very short sessions, sometimes are done by psychiatrists because they are so limited. But quite often you will see a psychiatrist involved in care pretty much only for the purpose of prescribing medications and monitoring that medication. So medical doctors these days are often the ones that are involved in care only for medications, and they are the only ones that can prescribe medications. So it used to be that the same person and this is in Canada, so it's different depending on your jurisdiction, but it used to be that the same person that did your therapy would prescribe your medications. Now that's usually different people. So the MD, the psychiatrist, or the medical doctor, could be a family physician, whomever it is, prescribes the medications, and the psychologist, the social worker, whomever that is, does the therapy. Quite often, they don't even talk to one another. That's not the ideal situation. Ideally, they would talk to one another, but quite often they don't. So if you have the opportunity to work with a counselor or therapist who is willing to liaise with your primary care physician or psychiatrist, take them up on that, because letting one know what the other one's thinking and doing can be helpful to your treatment. So I hope that this video has been helpful in kind of elucidating, like, what are those letters behind the name? What do they mean? What does that mean for me? Remember that really it comes down to personal choice. So if you have the opportunity to have like an intake session or a 15-minute meet and greet, that ideally that's free or that's lower cost, so that you can meet the clinician that you are proposing to, tell your deepest, darkest secrets to and work with for weeks on end. If you get the opportunity to meet them first and ask them what a treatment plan might look like, and ask them how long they they plan to work with you and ask them what their fee schedule is like and what their cancellation schedule is like, because like we're all busy and stuff happens. Ask them if they can do online versus in person. One might work better for you than another. Like I know in my situation, I live in a 3-bedroom apartment, and with my family roaming around, doing online therapy, not ideal. So I prefer to go in. Some people, for their schedule and depending on whether they are, shut in or have trouble getting around or have a car or whatever, might prefer online. It's up to you. So find out if that modality is available to you. All of these things factor into it. Don't be in any way ashamed if, quote unquote, all you can afford is a master's in social work. I have worked with master's level counselors and therapists who have been top notch and doctorate level who haven't really worked for me. And again, they may be top notch for you. It really depends on personal choice and all of those other factors that we've discussed. So let me know down below how you've managed to choose a therapist or counselor, what's worked and what hasn't worked for you. And if you are new to this, any questions you may have, let me know down below and I will be sure to answer them to the best of my ability. I just want to jump in here and mention that anybody that you are working with, whether they're a master's in social work, whether they're a PsyD, a PhD, an MD, they all have to be licensed with their local, either provincial, territorial, state board in order to be able to work with clients. So they have to take a licensure exam. They have to take that on a regular basis. So anyone you're working with is actually certified and licensed to be working with patients. So don't worry about that. It's not like any one of them is a quack, so to say, versus another. They're all licensed. They all have done education. They're all qualified to be working with you. So rest assured, whoever you are working with is qualified to be working with you. It really is a matter of personal choice, as well as those other factors that I've mentioned about who you choose to work with. Just relax. Do the work. The work can be hard. Do the work. Try to enjoy the process a little bit. It's going to be, I find that therapy can get harder before it gets easier because it's something that you're not used to potentially. It's new muscles that you're using. It can be invasive at first, especially when you're trying to get to know your therapist or counselor and they're trying to get to know you. You can be digging into some things that are uncomfortable with a person that you don't know. So, do that work, do the hard, deep work. Remember to keep talking about it. Remember that the therapist is there to help you, that they are there to guide you, and that if something's not working for you, they want to hear about it. They don't want you just to ghost them. So don't feel bad about going in and saying, XYZ is not working for me. How can we do this differently? How can we do this better? They may refer you to a colleague that does therapy in a different way. They can work with you to find something that works for you. So remember that and lean into the therapy and just do the best you can. Good luck.
Stigma Crusher.